Assalamualaikum doctors. In this video I am discussing about the history ADEM, that is acute disseminated encephalomyelitis. So the history it contains how it's come, like 7 years old boy presented with uncontrolled seizure, recent change in mood and abnormal movements. Okay. So uncontrolled seizure, recent change in mood, abnormal movement. One history actually come like that. 1 year old prolonged seizure, has fever, upper respiratory tract infection 3 days prior. Admit ward, done baseline investigations, all normal. Upper limb brief seizure medications, less test on syrup, capra vegabatrine only, plus global developmental delay. Unsure MRI brain result. Compliant to medications well, has consanguinity. First child passed away at 2-year-old with lung infections and developmental delay. Okay. So how can we do this history, like 7-year boy with prolonged uncontrolled seizure and recent change in mood? So symptoms, first we ask that started together or one by one. Describe the attack. Is it the first time or happened before? Usually the course is intermittent, improves and recurs. So that means it is intermittent occur. Before headache, any abnormal smell, feel, taste or flash of the light. During how start, how it aborted during, is there any eye rolling, tongue pitting, pee, poo, loss of control, describe movement, neck stiffness, loss of consciousness, weakness, it can occur in front of witness or even without witness. Then after confused, sleepy, weakness or abnormal gait. So in any abnormal movement or seizure, we ask before, during and after. Then any triggers like recent infection, missing meal, lack of sleep, pain, noise, flash of light, cry, fever, free of symptoms, always in front of others. Because DD of funny turn. So always in front of others, that is a funny turn. Once it comes, it is pseudo seizure. So again I am discussing the chief complaints analysis. First symptoms, started together or one by one. Describe attack. Is it the first time or happened before? Usually the course is intermittent and improves with and recurs. Before anything happened, like headache, abnormal smell, feel, taste or lash of light. During how start, how it aborted. Duration, eye rolling, tongue pitting, pee, poo, loss of control. Describe the movement, neck stiffness, loss of consciousness, weakness, if can occur in front of witness or even without witness. Then after, is there any confused, sleepy, weakness or abnormal gait? Triggers, recent any infection, missing any meal, lack of sleep, pain, noise, flash of light, cry, fever, free of symptoms, always in front of others. And DD is funny turn, in front of others always. Then FWASL, fever, weight, activity, sleep. Remember ADEM history, what we find? Acute disseminated encephalomyelitis, we find that preceded the fever present, there is preceded the attack by 2 weeks. So there is a prior to fever, there is a fever present, then this abnormal movement occur. Okay, then systemic review one by one. CNS, increase ICP, signs of any weakness, bugs, trauma, hemorrhage, shunt, behavioral abnormal movement, depression, loss of interest into something was enjoyable before. Describe for me his gait, unsteady, vision, any recent changes, hearing, affection of his sensation. Then other concerns like any dysmorphic features and chronic disease. Other systems one by one. GIT, any tummy size, tummy pain, poo, nausea, throwing up. If not the compliant, then oral and anal soreness. Nutrition, not number of meal, content in each meal, and salt craving. Salt craving, we know where, Addison's disease. So Addison's disease, hypoglycemia develop, any abnormal movement can be present. Serious heart racing, awareness of heartbeat, blood pressure, fainting with supine posture. So blood pressure, hypotension sometimes causes or fainting on with supine posture. Okay, chest, recurrent bark, musical sound, chronic cough, sputum, night sweating, urinary pee, color, amount, and if more at night than before. Anyone measures his blood sugar, change of concern about the private parts, pigmentation, endocrine, thyroid, Cushing, salt crisis, and numbness. MSK, skin spots, bruises, hypo or hyperpigmentation, swelling, lumps, bone and muscle pain, hair loss, and abnormal hair distribution. Then hematology, pallor, bruising, bleeding, and bug. Then we go the past history, 5T IOA, radiation, bug in brain, recent travel and medications. Then puberty, if relevant, perinatal nutrition, allergy, development, any loss of acquired skills, growth charts, vaccination, COVID vaccine and recent vaccination, family history of autoimmune disease, consanguinity, social, home, financial and psychological, home, old pipes, old paints, school type, attendance, absence and bullying and impact. Remember what are the DD we can tell? First of all, ADEM, acute disseminated encephalomyelitis. ADEM, what is the definition? Fever or for days due to viral infection or recent vaccinations. So remember, fever due to viral infection or recent vaccination, autoimmune, then resolved after 14 days, about 2 weeks, come with hallucinations, fears, abnormal movement and ataxia. CSF we find increased lymphocytic count with slightly elevated protein but less than 70 mg per deciliter. elevated levels of myelin-basic protein, which is a sign of demyelination but no oligoclonal bands. Multiple sclerosis in the first severe attack, CSF has oligoclonal bands. Acute viral encephalitis within 1 to 14 days, differentiated by CSF, lymphocytic pleocytosis with normal glucose and normal or mildly raised protein. Aseptic meningitis, Bell's palsy, brain metastasis, cardioembolic stroke, sting bite, recent travel. So brucellosis, these are pandas, pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. SSP, that is subacute sclerosing panencephalitis. SSP, what is that? It is a progressive neurological disorder of children and young adults that affects the central nervous system. It is a slow and persistent viral infection related to measles. Lyme disease, history of travel, erythema, migraines, carditis, cranial nerve affection. Cavernous sinus thrombosis. Cavernous sinus thrombosis, what we find? Severe headache, swelling or redness around the eye with droopy eyelid, convulsions and coma, treatment by high dose of antibiotic and steroid, and adrenoleukodystrophy. So ADEM, DD, headline just I am telling, ADEM, multiple sclerosis, acute viral encephalitis, aseptic meningitis, Bell's palsy, brain metastasis, cardioembolic stroke, sting bite, brucellosis, pandas, SSP, Lyme disease, cavernous sinus thrombosis, and adrenoleukodystrophy. Thank you.